to be here today on October 9th, 2024, and to see so many familiar faces. I think you're all familiar faces, so that makes me feel very, very humbled. And I tell you what, we'd also like to welcome everyone from Beaconsfield, Buckinghamshire, and beyond, everybody on the Instagram Live today as well. Welcome to the S-Thetics Clinic. My name is Ms. Sharina Balaratnam. I'm the founder and medical director of the practice, and it gives me great honor and great pleasure to welcome our patients here today, because it gives me great honor to welcome you to a team of specialists that are a team of two who have built something that has been so fundamental to my entire medical practice that I've believed in, something that's been so fundamental to my entire aesthetics practice, which I've had here in Beaconsfield for coming up to 10 years next May, and something that's been so fundamental to my belief in science, which is all about treating the patient, and treating the patient from a very, very core place, which is straight from the cell. For me as a doctor for coming up to 28 years, 29 maybe, I love treating patients to restore form and function to the skin, the face, the body, and that has been my background in plastic reconstructive medicine for 12 years during my time at the NHS. And having spent that degree of time treating patients to restore them functionality, as well as to treat them in improving their quality of life and their confidence to get back to a normal part of their life, whether it's from pediatric ages all through their adulthood, I feel like I do this exactly here in Beaconsfield. How I do that is with everything non-invasive now. I've traded in the scalp for everything topical, also technology, facial injectables. But what has really come to light in my profession is the story of light. So today here, I celebrate 4 years of introducing the Celluma low-level light therapy technologies here at S-Thetics. It gives me great pleasure to introduce my professional colleagues, and whom I now call as friends, all the way from California, who have actually brought the sunshine with them this morning. Would you agree? The day kicked? Yes. Were you all in a good mood when you woke up this morning? Yes. So because of you, thank you so much to CEO, founder, creator of our Celluma Light Therapies, Patrick Johnson. You're here all the way from sunny California. I'm so grateful to have you here.
It's absolutely our pleasure.
And Vice President to the company, as well as Head of Clinical Affairs, Denise Ryan over there. Thank you so much, Denise. And if I may say, between the two of you, you launched the company in 2011.
Yes.
11. And I'd love to hear the story of the company, how it has come to light, pardon the pun. Love to know a bit about you as well. And I'd love to hear why Denise dances on the stage as she wins these numerous awards and accolades in recognition of the fantastic work that you do for science and the creation of these devices. On behalf of my team, Chamindika, Banuro, Victoria Suter, Jonathan, I'd love to also say thank you to all of our patients, because many of you actually have these devices at home. So everything from the skin, face, scalp, body. Patrick, can you please share with us a little bit about you and how you have come to light creating Celluma?
Yeah. Well, it's my pleasure to be here. If it's October, it's London for us. Prior to founding Biophotos, I was in the orthopedic segment of the medical device industry, and while the company was very successful and our products worked really well, I came to the conclusion that they were supporting bad behavioral habits, and that I wanted my professional legacy to be more about wellness, much like Sharina's choices in her professional career. And so I went looking for something that would help people non-toxically, non-invasively, naturally, to improve their health and wellness, and and throw beauty in for a little extra bonus. And stumbled onto the clinical literature in low-level light therapy, and was struck by the breadth and depth and robustness of that clinical literature, but also struck by the fact that no one had really successfully commercialized the technology in a way that wasn't just a fad. And no one had approached it as a real medical device. So given that was my background, we decided to make a run at it and sort of take the high road in doing the clinical research and understanding fundamentally how light therapy works, I came to it very skeptically. Come on, flashy red lights, it's like, but the science is pretty amazing. And it's a very simple, but a very complex and elegant mode of treatment. And we're just pleased that we can share it with the world.
Share it with the world. But I'd love to know more. So you took a deep dive into the study of the therapies, into the study of the light,
Yes,
namely the wavelength as
yes.
well. And what did you learn so early on? Because obviously you were looking to bring something to the masses globally,
Yes.
to make something that everybody here can use within a clinic, but also for home use.
Right.
So how did that all then come to the production and creation of the actual device itself?
Yeah, not all light is created equal.
Mm.
And so you really have to look at the science to understand what wavelengths of light energy and what densities of light energy will trigger natural metabolic functions in the body. And so, at this point, I'm guessing there's close to 8,000 clinical literature papers on low-level light therapy, how it works and how it doesn't work. And one way we describe it is it's photosynthesis for mammals.
I like that.
and that what fundamentally distinguishes plants from animals is that plants get their cellular energy from the sun, and humans, mammals, just happen to have chromophores that absorb light energy, and when they do, they trigger natural metabolic processes that become compromised due to the environmental insults that we're subject to every day, disease, illness, bad behavioral habits, just the normal aging process. Arguably, you could define aging as the degradation of the mitochondrial process, and the fundamental benefit of low-level light therapy is turning back on the mitochondrial process, turning back on the body's natural ability to produce energy, cellular energy, and to heal itself. And so, that seemed to be a pretty good contribution to cap off my professional career with.
It's a great starting point, Patrick. And I want to go back 2 minutes where you mentioned it's essentially photosynthesis for mammals.
Right.
So when I take what energy stores plants have, they have chlorophyll.
Right.
And that's what absorbs the sunlight, and then it's that chlorophyll that creates the metabolic process, and that's why the plants thrive really, really well, and they bloom, and they're living well. So we don't have chlorophyll, we've got mitochondria.
Right.
So they're the powerhouse cells
Yes.
in our body, yes?
Yes.
So did you find that in your travels, in your studies, looking at low-level light therapy, do they all upregulate this mitochondrial function?
No, I mean, you need, well, a couple things. Cytochrome C oxidase is the fourth molecule in the cellular respiratory chain, or the electronic transport chain, or the Krebs cycle, depending upon what you call it. But essentially, it's the racetrack that drives cellular function. And what we're able to do is we're able to speed that cycle with specific wavelengths of light energy. Now, wavelength determines depth of penetration.
Yes.
The longer the wavelength of light, the deeper it penetrates in the body. So depending upon the condition we're treating and its depth below the surface of the skin, we pick very targeted wavelengths of light energy to address those conditions. And those wavelengths are inside and just outside the visible light spectrum. So in our devices, we'll use blue light, short wavelength, for treating conditions at the surface of the skin, red light for treating conditions between 2 and 8 millimeters below the surface of the skin, and near infrared light, which is not visible to the human eye, deep penetration as much as 25 millimeters below the surface of the skin. So it's what are we treating, where does it exist in the tissue, and then what's the appropriate not only wavelength to reach it, but then the density of the light, the fluence of the light, to provide a therapeutic dose and trigger the metabolic processes we're up to.
It's so clever because if you think about it, how many of you feels tired? And not just sleep tired, just tired. Everyone's nodding, Patrick. So that's my team are never going to tell me they're tired because they're not allowed to say they're tired. But everyone in this room, that's 100% of people maybe having a good night's sleep. But how many of us don't have a good night's sleep as well anymore? You know, I'm talking like a good night's sleep. So there's so many varying degrees of tiredness, but we now know, and it's interesting, 10 years ago, we looked at the causes of aging, the intrinsic factors, the biological clock, and the extrinsic factors. But now we know beyond the inflammation, which comes from lifestyle, sun, sugar, sleep, stress, hormonal changes, cigarette smoking, alcohol, pollution particles, that sort of thing. There's so many other hallmarks of aging that cause us to age naturally. There's also the telomeres are changing, nutrient sensing. We know about the insulin changes. We now also know about mitochondrial dysfunction. We also have autophagy, which is the cell cleaning process that normally happens. How many people hear about older people getting wax stuck in their ears, right? And they need to clear out. It's because the normal cleansing process from in to out slows down. So autophagy, again, that normal clearing out process. So now in 2024, we now know that there's 12 hallmarks of aging, and one of it being mitochondrial dysfunction. Those basic powerhouse battery cells in the body, that's why they're getting low. So it's no different to the electric car. You plug in an electric car, it's 100%. You take it out for a long drive, and it can only last X number of miles, depending on the brand. So would you say that these can turbocharge us up and top up our mitochondrial function?
Oh, absolutely. And I think, you know, as a commercial enterprise, we're fortunate because light therapy has sort of gone mainstream. You know, that people actually, you know, are familiar with the word mitochondria. And but there's also sort of a dark side to that, you know, when you become successful, you're mimicked or copied. And so we see a lot of light energy devices coming into the market that aren't necessarily practicing the science. And so, you know, and that's something that we have to educate against in the market to make sure that people understand that they're buying true medical devices, that these devices have been reviewed, that they're supported by clinical data, and that you'll actually get predictable results from them. And it's, you know, and again, while it simplifies and makes it, you know, understandable to say it's photosynthesis for mammals, in light therapy there are multiple different mechanisms of action, metabolic processes that we're triggering. And so it's not all light is created equal.
Correct.
And so depending upon the condition, that will determine the dose and the wavelength of the light energy, and will determine what mechanism of action we're actually affecting.
So cellular functions, basic cellular functions. So it's almost like if I'm making something great, like a curry or something, I need a recipe, and I need a certain dose of chili powder, a certain dose of turmeric, and a certain dose of something. Even when it comes to Botox injections, I know that there is a therapeutic dose that it hits the mark.
Right.
Some patients will fall underneath it, some patients a little bit more. So very similar to Celluma, there is a therapeutic dose. Yeah. And that's the 30-minute dose.
Right.
Roughly.
Well, yeah, and it's actually, we call it the biphasic dose response curve, and it's basically within a very specific dose range, which is a normal bell curve. You're going to get the desired metabolic result. And so that is between 2 and 10 joules per centimeter squared, a joule being a unit of energy. And so below that, you're not delivering enough energy to trigger the metabolic process you're after. And above that, you actually have the risk of creating a phototoxic event and damaging the tissue.
Yes.
So again, this gets back to, you know, those products that you might see on Amazon or Alibaba or other places, you know, that are a tenth of the cost of our products. And it's like, well, they're cheaper for a reason, because they're not proven, because they're actually not practicing the science. And so, you know, that's why we do these kinds of things, to make sure people are educated and know you're using devices that are going to be both effective and safe.
And safe. And I think that's the key point. And I very much get asked when I've hit my 20 units or 20 units or 24 units of toxin for the frown, and someone will come back to me and say, can I just have more so that it lasts a little bit longer? We wouldn't be giving anyone more therapeutic benefits. We wouldn't be causing them any harm, but it might spread to other areas and cause a bit of a problem. So I often get asked, Dr. Sharina, this is great, but I can get one from China, which has 50 joules of energy. But it may not have the CE mark, it will not have the FDA clearance, but they think more energy means better. But looking at your bell curve, the more energy will be, and we know from science, will be damaging to cell function.
Right.
Is that correct?
Yeah. More is not necessarily better in light therapy. There is a sweet spot. And how our devices interface with the user, how they're applied to the body, and then how much power they have times time of treatment is exactly inside the bivasic dose response curve. So we're going to get the desired results we're looking for, regardless of what condition we're treating.
So with that being the fundamental principles, you've had some fundamental principles of your device. And how did you then evolve to 4 years down the line? So in the last 4 years, when I first brought Celluma into my clinic in September the 20th, 2020, and I remember that so well because in 2019, I came across Celluma at the Face Conference in London. And I remember walking across, and we look at so many stands, and I saw this beautiful thing, and it was there all shiny. And I went up to the supplier and I said, wow, what is that? And he said, it's a flexible shape-taking light therapy device. And I thought, wow, 20 years ago in 2005, I did my master's in light therapy. And these were big chunky devices and PDT and things. And now here's this thing that you can flex and shape and put all over your body. And then in the end of the year, I watched Denise Ryan dancing on stage as he won the Aesthetic Awards in 2019 for your innovation. And that's when I knew this was going to be good. So in 2020, I brought this into my clinic. We have 3 devices upstairs. I have 2 at home, the Pro for me, my husband, my 3 pets, because that's what I brought it in for. Whole body, whole family, right?
Yeah.
Because it affects our cellular function for skin, face, and now scalp and body. So I'd love you to then tell us how you managed to roll it out year after year to all your different devices that we now have all of for the skin, the face, the scalp, and the body. That's a big one.
Yeah, well, light therapy is such a fundamental modality of treatment. I mean, it's sort of comparable to hydration. You know, if you didn't know the benefits of hydration and therefore you didn't hydrate well, you would probably be sickly, you know, in every possible way. And then if you started, you know, partaking of this magic elixir called water, your health would improve in every way. And it's much the same way with light therapy. You know, the upregulation of the mitochondrial process is one of the fundamental benefits, but as a side benefit that we increase microcirculation.
Yeah.
So we're increasing the flow of blood to and away from tissue, increasing the delivery of nutrients, increasing the delivery of oxygen, increasing the turnover of fluids to the tissue, making the tissue healthier faster. Yeah. And so that's a real improved benefit on kind of the sports medicine side of things.
Yes.
In pain management. So, you know, in aesthetics, we're stimulating fibroblast cells, increasing collagen and elastin production, rebuilding the matrix in the skin that gets lost over the years. We're attenuating pain. And then, as you mentioned, hair restoration. Hair grows in 3-phase cycles. The first phase can be 2 to 7 years long, and that's when our hair is growing. And then it goes into sort of a transition phase where we lose it, and then it goes into a dormant phase. And sometimes the hair gets stuck there. The follicles get stuck in that dormant phase. And like activating fibroblast cells, we can activate follicle cells and turn back on the process of hair growth. So that got us into hair restoration. And then our latest indication for use, which should be in the UK by the beginning of the year, is body contouring. And I say body contouring distinct from fat reduction, because again, we are non-invasive, non-toxic. What we know from the clinical literature is when you expose adipose cells, fat cells, to specific wavelengths of light in specific amounts, we trigger a transitory porosity, or we temporarily make holes in the walls of the fat cells, allowing fat lipids to leak out into the interstitial tissue. And so we're not destroying fat cells, we are just making them skinnier. And those fat lipids then get washed out of the body through the normal lymphatic system and the circulation system. So we're actually reducing the circumferential dimensions of the hips, thighs, and abdomen in a non-destructive, and so there's no pain, there's no downtime. It's completely natural, and then hopefully that gets augmented with maybe some improved behavioral habits. It can get coupled with lymphatic massage to stimulate drainage. Again, as you were talking about earlier, as we get older, we don't shed waste as well as we do.
Correct.
And so the Celluma CONTOUR is going gangbusters in the United States.
I bet.
And we're really excited about getting it here in the new year.
Well, funnily enough, we have a couple of patients who are trialing and doing the Celluma CONTOUR study with and for you. And we're just seeing the most amazing results, coming back from our patients and our study patients as well. So I just think it's mind-blowing how you've created something that is so natural, using light that's all around us all the time, just harnessed in a very control, safe, dose-effective way that is augmenting all of our cellular processes. 4 years on. How many of you have the device here? Oh, that's a lot. 1, 2, 3, 4, 5, 6. That's a lot of home use that you're using as well as in-clinic use. Have you all seen benefits? Nods.
Yes. I thought visible. A lot of great growth in my hair from using it.
Oh, well done. Which is just brilliant, because we look at those wavelengths which you've created, the Celluma Pro, for example, which we have in the clinic, which I believe all of you have, and it works on your blue wavelength to kill the bacteria. So I think a lot of us here also have families, friends, nieces, children, going back to the original one which we brought in for acne management. So can you just shed some light again on how that blue light kills the P. acnes bacteria factor?
Well, and again, in our acne program, we use blue light and red light.
Yes.
So the blue light, we're using actually the C. acne bacteria, when exposed to blue light, releases porphyrins inside of it, which result in the rupturing of the bacterium cell membrane. And so the bacteria sort of commit suicide. And in the absence of C. acne bacteria, you can't have acne vulgaris. Now, there's lots of other stuff that contributes to acne, like hygiene habits and nutrition and raging hormones in teenagers and those sorts of things. But we're taking a fundamental root cause out of the equation. So that's actually kind of prevents future breakouts by taking away the cause. But it doesn't do anything for the existing lesions. For the existing lesions, we're using red light to, again, increase circulation, increase the fluid turnover to and away from the existing lesions to get them to resolve faster. So, it's well known that blue light, is good for treating acne, but no one sort of thinks about, but what about the existing lesions? How do we address those? And so we're actually, in our treatment program, we're preventing future breakouts while addressing the existing lesions.
And that makes does that make sense, everyone? It's so important, because I see so many patients who are then talking about their 12 and 13-year-old children who are naturally going through hormonal change. And the chaps are out and about, they're on the football fields, they're getting naturally more greasy as well. Most young boys, sorry to my nephew, they just don't wash their faces as well, or they may not know what to cleanse their faces with. And aging also, as it's accelerating because of this oily skin acne problem, is a change in the microcirculation. Not as clean flushing in, not as well flushing out. So you have a light therapy that is not going to be so abrasive for the skin in terms of being a topical like benzoyl peroxide. It's not going to be harmful to a young skin because we're not putting anything on it. It's very, very safe. And I've lent mine to all of my nephews and nieces just with a little bit of gentle cleanser, wipe out. They've got glass skin now, 3 months down the line.
Yeah, and what we discover, and it's only anecdotal, but teenagers, once their acne resolves, they'll want to continue to use the Celluma because what they find is it helps them sleep better. Because we know that light therapy will trigger serotonin production in the brain, the happy hormone.
And in the evening then, haven't you? Could you imagine if you have your Celluma too early, you'll be asleep.
Well, yes, and you wake up several hours later, thinking someone's trying to suffocate you because your Celluma's on your head. But yeah, it's perfect, to put it by your bedside table, and in the morning when you don't have your makeup on yet, you get up a half hour early, you pull your Celluma on, it puts you right back to sleep, you get half-hour anti-aging treatment, and then you're ready to get on with your day.
Fantastic. So you literally turn on the cells.
My teenage son is 16, he has bad acne at the moment, and we're using Celluma Light to treat him, and it's working incredibly. He had a huge eruption, and he's like 1 day later, it's healed. It heals it very quickly, and it's and preventing. But he uses it at night, so he showers and cleanses, and he uses it at night. It's very helpful for him to then be able to go to sleep as well. We've really noticed that he's not quite so distressed as well when he's going to bed about his spots.
Nice.
Yeah. When we
that's a lot of it, the distress that comes.
Oh God, yes. When we started the company and we started, we used most of my family members as guinea pigs. My 17-year-old son was struggling with acne, and a big part of the struggle was the embarrassment. And his mom's esthetician was sort of doing everything she could for him and put him on herbal scrubs, which took care of the acne, but it made him, red as a radish. And radishes are red, right?
Red as a radish.
Not a big vegetable guy, particularly root vegetables. So his dermatologist wanted to put him on Accutane, which is like almost a chemotherapy drug. And so we said, no, we're not going to do that. So we took him off everything and we put him on the Celluma. And in 2 weeks, he cleared up completely. We forgot to take a before picture.
Oh, no.
So we took him off, and he immediately broke out again. Yes. And we treated him, and we took the before picture, and we treated him, and he cleared right up. So it is very traumatic. I mean, and it's one of the fulfilling parts of this business is having a meaningful impact on the quality of people's lives, whether it's a parent who's struggling with a child who's got bad acne or the child themselves. So.
Or the mature onset acne. So I had a problem after lockdown with the mask, Patrick, where florid acne just because of wearing something in close contact and sweating underneath it. So that was a huge problem for me that was saved with the device. And a lot of my team had it at the time and patients as well. And now what I'm seeing more in patients going through hormonal changes, not just menopause, but more stress related. Everyone's getting breakouts that they'd never expected. And this is a really great way to, again, upregulate the microcirculation, downregulate the P. acnes or kill it altogether, upregulate the autophagy, the cell clearance, turbocharge the mitochondria. So we're just enabling that person to perform as high function as they can to heal, and also to make collagen, elastin, and hyaluronic acid, keep cell function. Is that correct?
Yeah.
Sounds too good to be true. I mean, look, I'd love to show some of the before and afters just really quickly, but this was my first case study. I think you recognize. This was October 2020, 6 weeks after Spartacus had his back surgery, 6 weeks after Celluma light therapy. So he had a very bad, long scar on his back for his legs were going on in. But look at the fur grow back so quickly in 90 days.
Yes.
So that's the hair study right there.
Yeah. Absolutely.
If I think the red kites do think Spartacus is a cat. Zan, can you pick up the Celluma RESTORE that's behind you? Because that's another one of our case studies beside your case study. Oops, at the top, Victoria.
Up above.
So sorry. Thank you, Zan, for the showcase. So that, again, is a great before and after. One of your case studies, Patrick, and the one on the left is ours.
Yes.
And we use the Canfield hair metrics to study the follicle density, interfollicular distance, the thickness of the hair. And that's, again, only after 90 days. That's very fast.
Yeah.
With no
Yeah.
topicals.
Yeah. And interestingly enough, the original sort of seminal study on low-level light therapy was a famous rat study where they were implanting tumors in rats. And while we know that low-level light therapy doesn't do anything for resolving tumors, what they saw on the rats was amazing hair growth that were treated with low-level light therapy. So they knew something was going on metabolically 50 years ago. And it's, been a progression in the clinical science since then that sort of brings us to this understanding of how low-level light therapy can be beneficial to everybody in the family.
Correct. Including Thor.
Including Thor.
Yes.
Yes.
So this is Thor post-knee surgery, running around, busted his sutures, and that's him 2 weeks later. So again, the wound healing responses. So we do a lot of work with microneedling, skin resurfacing, post-lasers, etc. So this accelerates our healing response.
Absolutely. We know that low-level light therapy will accelerate the proliferation of fibroblast cells in closing slow or non-healing wounds. And it's, again, the Celluma is medically CE marked for wound healing.
Wound healing. So does that make sense, everyone? Because we're creating micro wounds with our fractionated lasers. Alison, you've had 3 good doses from me over the last, and we haven't actually used the light because you're a study for something else, but today we're going to speed things up for her. So thank you for being my study. And I'd love Chamandika to share this, if you don't mind, Chamin.
Yes. My mom suffered with arthritis, rheumatoid arthritis. So she's been like 8 months now. So when I said my history, so she said, why don't you pick up one of the Celluma and put it on her arm? And I never thought about this.
Yes.
Because suddenly she got really badly bruised, like swelling up. And then I took Celluma and I put on her arm. Same time I noticed that the redness is gone. She had a lot of comfort after the pain is gone.
Yeah, absolutely. Celluma is FDA cleared for treating both rheumatoid and osteoarthritis. So
this
not
is
surprising it worked.
So this is what we're going to be launching in the clinic next. I'm celebrating my coming up to 1-year anniversary since I bought Celluma Deluxe Full Body for myself because I already was convinced on the benefits of it for my skin, face, scalp, and I just needed it for my body. I was traveling a lot internationally, being in a plane, and I wanted to protect my body, and it's kept me functioning really high. And this is what we're going to use on Chamandika's mom to really influence the whole body for her as well. So Celluma Deluxe comes to Beaconsfield, and tell us about this.
Yeah, and the thing you have to remember is that light therapy is not only therapeutic, it's also prophylactic. You can be using it to stay in front of things. And so I'm an avid bicyclist. On Saturday, I did a 100-mile bike ride in California, with the 100 miles, the easy part. It's the 7,000 feet of climbing that was the hard part. But I use the Celluma prior to my rides to vitalize tissue, to increase microcirculation, to get everything loose and moving, and then I use it afterwards because I've released a lot of bad stuff in my body, pedaling for 7 hours, and the light therapy is really good at just treating the entire body.
Pre and post, actually.
Yes.
So I see a lot of runners and cyclists, marathon runners, etc., high performance athletes, and I always say use things like this, right, Michelle?
Yeah, I have golfers, clients who train golfers, and this is ideal. So it's part of like a warm up routine for them. So I give them their mobilizations and their stretches. But before, when they wake up first thing, get on the Celluma for the low back, knees, hips, all those rotational elements, and they use that kind of pre and post rounds of golf.
Yeah,
It really helps performance.
a lot of golfers suffer from spinal stenosis.
Absolutely.
Yeah.
And while we're not going to do anything about the calcification of the vertebrae, to the degree that that's impinging on a nerve and creating inflammation, we're able to knock that down, and people are able to continue to golf without having a pretty invasive surgery.
So this is my father that Victoria has also seen and treated virtually from, this is 2022 when I first got home to Malaysia and took him my Celluma Pro. He just had rotator cuff surgery, feeling a little stiff. So that's him reading Tatler and with the Celluma Pro on his body. So now I've recently taken him my full body Delux home so they can use it, because I want to protect them as long as I can, as best that they can. But you've managed to create a new Celluma Delux for us to incorporate the contour application
Yes.
within it for body contouring.
Right.
That's amazing. So are you talking now a full body panel that I could effectively lie under for 30 minutes, fall asleep, and it will increase the porosity of my fat cells?
Yes. Where you choose to have them increased, and where you don't, you just cover it up.
Like
because
cover my chest area?
Yeah. Because, there's a parts of your body where you want fat. I mean,
Yes.
we don't want to lose it in the face.
No.
And so, if fat loss is not desirable, or reduction in, the body shaping isn't desirable, then we just cover it up.
That's amazing. I mean, I just want to say congratulations, because that's next level. I think every girl's going to want that. So look, we're going to be talking about positioning upstairs. I'm going to be here sharing results. But look, this is your time, everyone, to be with Patrick and Denise and to ask them all the little questions that you might want to. We've got before and afters coming out of this clinic. We can't keep up. Amy, this is your dear husband, Alexis. Everyone becomes a patient because they want to see the results that they can see, feel. This is Jonathan behind there. Again, just going from strength to strength. Yes?
Really?
Yeah. And I think that's the key thing. If you don't take the before picture, you'll never know where you end up.
Yeah.
So that's really key. But we're excited to launch Contour here when it comes out. We've got the Delux here already. And this is one of our case studies that I've just pulled up for our Contour. So she's only 1 month after the treatment. And again, there's been no change of lifestyle. And you can see there's just a change in the whole appearance of the body. So we look forward to seeing the 3-month results now. Any questions for us? Multiple awards. I cannot congratulate the two of you and all of your team in the United States and California for these awards that are just spilling off my screen right now. And you won one last week. I know. Did you use it?
Yeah.
I love a brag book.
Yeah, that slide's 2 years old. Yeah.
We need an update.
Get that updated.
Yes,
Yeah.
but I do believe in, I love Bowie, and I do believe in this saying, tomorrow belongs to those who can see it coming. And that's how I feel with your devices. So I want to thank you for sharing all of this with me. Congratulations, Denise. I'd like to thank all of our patients for sitting in and listening. So fancy a little bit of positioning and, seeing how this all works.
I would ask a question.
Yes.
How would you feel that would benefit somebody with peripheral neuropathy?
We actually have an IRB approved peripheral neuropathy study going on right now.
Right.
And anecdotally, and what the general clinical literature shows us, it should be very effective. We're going to wait for the results of our study and then make sure that that's compelling to the FDA. But your doctor can recommend it as an off-label use.
Right. So that would be the pro then, the big body.
Yeah.
I'm thinking of Brian.
I know.
We use the Pro in the pain setting, and for the last 10 years, we've seen amazing results. You won't see it on our literature or our website because we don't have a medical indication for that. But we've had amazing responses and anecdotal results.
And I think, to your point, Alison, I think it's a cumulative result, because I always say when a patient presents to us, if I present it to myself, I'm not really on a baseline of 0. I'll be on a minus 20% or 30%, depending on my sleep, what I've been doing, how I've been working. So I almost have to get myself to a baseline and then boom, and then treat myself. So again, with anybody, I would say multiple treatments, 2-3 times a week, just to get them to 0 and until you see that next. Yeah. So I would love to see him for a one-off. At least that way he can just lie underneath it, see how he feels, and just go from there, really.
Yeah, that could be life-changing.
Really in trouble.
Yeah, sure. With pleasure. And then I think our team had a couple of patients ask questions online that we'd just love to share with you. One of it is Cheryl, and she'd like to know, she's carrying out facial acupuncture, facial massage at the moment, Patrick, where she uses acupuncture needles. Do we use the Celluma before the acupuncture needles go on, or can you use it over the needles without touching them?
Yes.
Over?
Both.
Both. Okay.
But there's absolutely no reason not to use it just right over the needles. But you can use it beforehand as well to sort of, prepare the tissue. But we see acupuncturists using it right over the needles.
Okay.
Absolutely.
Fantastic. And then we've got one final question that our patient wrote in this morning about. Do we have that on us, guys? That's okay. We'll pull it up for later. Not a problem at all.
Yeah.
So about your son's acne.
Yes.
How often did he? I'm amazed it cleared in 2 weeks.
Yeah.
So that gives me hope. But was it every day?
Yes.
Yeah.
Yeah. So
once
that's
a day or just once a day?
just once a day. Yeah. Yeah. I mean, he'd use it at night and like fall asleep under it.
Yeah.
And if you're watching, Willie, I'm sorry.
And thank you.
Took one for the family.
Takes one for the team.
Can I just ask on that as well?
Yes.
You said that you didn't have it before, and then you stopped it after 2 weeks, and it came back.
Oh, he
So
broke out immediately.
Is it something that would have to go on indefinitely?
Well, I mean, when you're in that sort of hyperactive hormonal stage as a teenager,
yeah.
And again, if you've got nutritional issues and you've got hygiene issues, so all of that stuff goes together. But again, with the light therapy, we were killing the root cause. And when we stopped using it, that cause came back, and so you'll have to do maintenance during the teenage years, because
I'm kind of interested because my son's 26.
Yeah.
And I mean, this morning his face looked terrible.
Yeah.
And he is pretty. For a 26-year-old male, he washes. He's spent a fortune on different things, and it just keeps. It's almost like a girl being hormonal.
Right.
Maybe men also have cyclical hormones.
Absolutely.
But it is a bit like that. So
Yeah.
I'm kind of interested for him because I mean the medical profession haven't really come up with the answers yet.
Right.
So
Right.
he's tried a lot of things and nothing's really worked. So.
Well, it's not going to hurt, and it's likely going to help.
I mean, the only thing we were offered is, as you're saying, the Roaccutane. Very, very strong. I'm scared.
It does work though.
Yes. But
That's
what
the end
they're
result.
saying,
Yeah.
why I'm so interested, and it took William a while to find the time, and now he's seeing the results. He's a bit obsessed with your Celluma because what I'm saying to him is your life. It's going deep under the skin the same way the Roaccutane. The only thing that's going to stop the acne in its tracks. Everything else is just a topical. It's a bit of this, it's a bit of that. And by the way, Sharina will back me up on this. Don't let your son use masses of different things. It's very simple, isn't it?
No say in what.
I think that was my son's
right?
problem. Was he got so panicked. He was having a bit of a scrub, a bit of this, a bit of some, and when he saw a professional, they're like, you mustn't. All of that is actually
It's too much.
Too much.
Yeah.
It's making it all even worse. Yeah.
And that's
but what he's understanding, and he's even read. Is the light is going underneath and just stopping the production of the bacteria, stopping in the tract in the same way a Roaccutane drug would do, which just sounds very scary with all the drying and things. But yes, the only way to really stop the acne is to just stop it in its tracks.
Yes. Or not be a teenager.
And then eventually, maybe you do eventually go out of it.
Yeah. Well, yeah, you do.
He's definitely not as hormonal as he was at 16.
Yeah.
Now at 18, he's obviously gone through that.
Does your device accelerate the maturation of teenagers?
Brain cells.
It's an indication we're working on.
Yeah.
Though, as someone who has friends who have teenagers, I have teenagers of my own, but the young girls are using so many different topicals and then mixing them, and what I've noticed about using the Celluma is I now need less. In fact, less is more, because it's helping my skin be a lot healthier. So I don't feel I need to use these masses of products. I use a great cleanser, a great serum, moisturizer, but it's making my skin that much healthier, and feeling brighter, and which makes me feel very positive when I look at myself in the morning. And it just all has this lovely benefit.
Right.
But I just wish that the younger generation would pick up on that, because I think they're just using far too much and possibly doing long-term damage. And that worries me about that generation.
So there are studies now that we know we change in our mitochondrial function. Aging is a loss of perfusion, so this is upregulating the perfusion to the body. That's why you get therapeutic aesthetic benefits, pain management benefits, and sports rehab benefits as well. But we also see a change in the microbiome. So just like how we have a gut flora, we have a skin flora, a natural microbiome. And it's meant to be diverse, and that's just how it's meant to be. But we change in that microflora as we naturally age. Big change around 65. But we're seeing a lot of changes happen in an accelerated way because of this overstripping, overprocessing, too many aesthetic treatments, the wrong treatments in the wrong sequence too often. So that's why we're very clear in our regimented ways, because we're protecting the skin flora, this microbiome. So you are absolutely right. Buying off the retinols online, not really knowing what we're putting on the skin, glycolic peel pads, just everything going on is disrupting a microflora, which is also changing during a teenage year. So, light therapy, I love giving to my nephews and nieces because I know it's just so beneficial for everything. So,
and also, if there's
to your point,
you can use it on any injuries, like rugby injuries. I mean, we spoke many years ago. It was around the time of 2020, the long COVID days, and I know it wasn't something that obviously you could have, said on your studies, but it was helping my younger son recover from long COVID.
Well, fundamentally, COVID's a inflammation storm inside the body, and the fundamental benefit of light therapy is knocking down inflammation. So, sort of intuitively, you would think it would be beneficial, even though we can't make that as a medical claim.
But anyway, the 14-year-old, he's now 14. He's a huge fan.
Excellent.
He says thank you.
Excellent.
All ages. So, any advice to our existing Celluma users who already have your device, Patrick? Any top tips?
If you don't use it, it won't work.
So true.
Okay. And do not lend it to your mother, because she won't give it back.
Too late.
Yeah. I mean, it really is. I mean, and we were talking this morning. Someone has it and keeps it upstairs. And if you're not going to go upstairs and get it, you should have one downstairs. So, we have multiple Celluma in our house. We keep them at our couches where we watch TV, and just, throw it on ourselves for 3 sessions, and
I put it on my shoulder. Someone puts it on their injury or burn. Do it on the face, then it's there.
You need to. It needs to be the first thing you reach for. When anything ails you.
Not even your husband.
He's the last person you want to reach for.
Yes.
You were talking earlier about the sweet spot, and
yes,
there's a good dosage, and it's 30 minutes.
Mm-hmm.
Is it possible to use it too much? Is there
No. I mean, and it's very much like leaving your cell phone plugged into the charger overnight. It probably charges the battery to full capacity in the first 2 hours, and then it doesn't do anything until you start to deplete the battery, and then it will take more charge. So it's very much the same way. That's with a device that's designed to deliver inside the biphasic dose response curve. There are devices out there on the market that are very powerful and can damage the tissue, and so those can be overused. Yeah. But at least in the case of the Celluma, there's no overdose. It may not be helping, but it won't be harming you.
And then I have one, I keep getting asked this all the time, and you have a great answer for this. How long will your device last for?
Yeah, we've done accelerated testing using it 4 times a day, 4 days a week for 3 years with no degradation of the device. The LEDs are life rated for 100,000 hours and don't start degrading for 10,000 hours, and so that's like 20,000 treatments. And so if you used it 3 times a day for 20 years, you might start getting some degradation of the LEDs. So there's basically 2 things you don't want to do with your Celluma. You don't want to put full body weight on it.
Mm-hmm.
You can lean against it, but you don't want to stand on it. You don't want to sit on it. And you don't want to fold or crease it. You can roll it and flex it and curve it all you want, but you don't want to sort of fold it in half. If you don't do that, it will serve you for a long time. We actually, we got back the very first device we sold. It came into our repairs department within the last year, and it was in really good shape, but some of the wire connections had broken down, and so we kept it and sent the person back a new one because we wanted. But it had been out there for 14 years, and so with a little tender loving care, your Celluma should
outlive us.
Yeah, I like to say we'll burn out before it does. Yeah.
That's good. Thank you so much, Patrick. Any questions, anyone? We're going to head upstairs, do some demos on all the different devices that we have here in the clinic. Oh, there's one more by Banu. Do you want to read that, or shall I?
No, it was just from one of our patients.
Sure, absolutely. So here is one, Patrick. We have a patient who actually has your device at home. She couldn't make it today. She sends her regards. Her son, who's in his 20s, has atopic dermatitis. It's severe. Currently using Rinvoq, so I'm guessing it's a immune mediator. Can he continue using this while on his medication?
I'm going to defer to Denise on that because she's our clinical affairs specialist.
So we always, just be on the safe side, suggest that the patient check with their GP, their physician. We have seen, again, anecdotal results really, really good with atopic dermatitis. We can't make a claim to help or heal or cure that.
Sure.
It's very unlikely it would do any harm. So I always suggest if you own a Celluma, try it. You might be very pleased and surprised.
Okay, yeah. I'll be in touch. Yeah. She's a doctor as well, so this is very useful.
Okay.
Wonderful. Yeah. Excellent. Well, look, let's all go upstairs. We've got a great model to showcase on. And I want to thank each and every one of you for coming. There's some fantastic offers today as well for today. And we're incorporating this lovely event. We would like to thank Patrick for coming all the way from sunny California, Denise Ryan as well. Thank you for your 4 years. We look forward to a bit of cake cutting. Please help yourself to some cupcakes out there. And yeah, a big thank you. See you. And I'd also like to say thank you to all our existing